Now I'd like to talk to you about salicylate. There's always a question on aspirin on board exams. It's a unique poison. It's so dangerous a drug it probably never get FDA approval if it had to go in front of the FDA today. And there's going to be a question or two on salicylates. It's worth going over. The salicylate question they present to you in either one or two ways. One, it could be an elderly person that has an arthritis of any type, and they're taking pills for their pain, and they're going to start to complain of nausea, vomiting, and tinnitus. Tinnitus is a key thing. If you see tinnitus in a question, you're going to start to think about aspirin toxicity, get an aspirin level. The other way this case will present is the typical overdose case of someone that's depressed. Here we have a college student who's been depressed lately, and she has tinnitus, so you think aspirin. And she also has some of the other signs of aspirin toxicity. You can have tachypnea, you can have fever, shortness of breath, and your mental status can be anything from normal to coma. Anything in between, a little confused, lethargic. All these are consistent with aspirin toxicity. Aspirin is one of those things where the pH might be high or low. The aspirin causes a respiratory alkalosis, and that's usually early on, the poisoning, so the pH might be above 7.4. A little bit later in the poisoning, you get a metabolic acidosis, and then your pH will be less than 7.4. So expect to see any pH on an aspirin poisoning case. All right? If someone comes in with aspirin, we are going to use the oral gastric hose and do oral gastric lavage if it's less than 2 hours with a significant ingestion. We are going to give charcoal to try to block absorption. Once the aspirin's already absorbed, this is one where we're going to correct their acid-base balance and give bicarbonate IV. We want to get a urine pH about 7.5 to 8. If the urine pH is 7.5 to p8, we're going to maximize excretion of the aspirin from the body. Don't forget, on this case, to send the patient to the psychiatrist if it was a suicide attempt. This is one of those few things that's dialyzable, so when do you call the nephrologist? When they're sick. You can memorize the list if you want, but it's easy to remember when they're sick, severely acidotic. Okay, if they're having coma, they're unconscious. If you're having seizures, if you're having renal failure, yes, you need dialysis. If you have a pulmonary edema picture from your aspirin poisoning, you need dialysis, all right? Some people also go with very high salicylate levels, for example, 130 milligram per deciliter after 6 hours after ingestion, indicating that they're going to get in problems later from their aspirin poisoning. That's the end of aspirin poisoning.